everyone, welcome to my channel Isha's Physio Beyond Just Physical. In PCOS series part 4, we have come to the most important aspect of the topic, that is management, which is definitely our ultimate goal. So let's get started. In management, the first comes the medicines. Before prescribing any medications, we need to check the age, patient's weight, patient's symptoms, and their ultimate goals. Examples: infertility, according medications. In case of hyperinsulinemia, then the metformin dosages. If the patient complains of irregular menses, then low dosage of progesterone to maintain the uterine linings. You may know them in the form of OCPs. Also, some hormone medicines like GnRH agonist and many more. Similarly, other symptoms like acne have their own treatment. External hair growth are treated these days by the permanent laser removals also. Depending on the severity of the symptoms or conditions, there are few surgical procedures also available. Example: endoscopic cauterization or CO2 laser, vaporization of multiple cysts, IVF treatments, artificial reproductive procedures, and many more, depending on your symptoms. Also, these days researchers have found that few form of treatments in naturopathy like hydrotherapy, mud therapy, fastings, and various combinations have come up and proved to improve ovarian morphology. Also, various branches of medicines like homeopathy, Ayurveda do have their own ways of treatment and time to have effective results. But consistency and discipline is must to achieve any goals. Next is the balanced diet, which we have already covered in detail in my previous video. Role of exercises. It's a vast topic. I will cover in detail a bit later, but the basic effect of exercises is to decrease the risk and restore fertility, and hence improve the quality of life. Also, stress-free environment is very important to be considered in the PCOS management. Emotional aspect along with the physical and mental alignment is very important to stay healthy. Girls in PCOS goes to depression, anxiety very commonly. They feel like it's my fault. They, why me kind of negative thoughts. They start hating themselves. They are rude to themselves. They judge themselves harshly. So let me tell you, cells in our body feel every emotions we feel. So when we talk negative about ourselves, they can feel that and they become fearful. Hence they shut down and shrink, because of which they are not able to function properly, accept the new trends available, which is more dangerous. Hence, it's very important to love yourself, accept yourself, improve yourself every day, but without judging very harshly. Tame your thoughts, stay positive, live in present. Join your hobby classes or do the activities which you like the most when depressed. You can do paintings, music, dance forms, anything which you like, or the exercise forms like swimming, jogging, badminton, skipping, cycling, whichever you're comfortable with, which makes you happy. Also, it's important, especially for us, to get time for ourselves. 30 minutes or 1 hour in a day, mark it in a calendar, make sure you have your own me time. Don't be a robot and find self time. Also, it's said that skipping meals or improper sleep can lead to stress. So, follow your circadian rhythm, that is your body to moon and sun cycle. It will heal faster, align your routine, sleep properly, discipline manner, early. Don't use devices before going to bed. Eat 2 to 3 hours prior to your bed to have a peaceful sleep. Also, pranayamas, meditations, yoga, prayers, being close to nature are beneficial in combating stress. Stress has drastic impact on your endocrine system, which releases hormones and thus affects PCOS. So, at most important to bring the small changes in your lifestyle to fight any disease and lead a healthy life. Yoga. I'll go a bit into details. It's our ancient tradition. As I mentioned before, it's one of the very important part in relieving stress. Also, it's been proved to decrease your BMI, your weight, hair falls. Also facilitates menstrual cycles. Hence, one of the important aspect of management in PCOS. Yoga keeps you healthy physically and mentally by improving your flexibility, decreasing your tightness, also improving your focus and concentration. There are 8 limbs of yoga and 5 important tips which they used to say. The right exercises, right diet, proper breathing, proper relaxation, and positive thoughts can lead you to a healthy and peaceful life. Quickly, just down asnas which are useful for PCOS. This exercise is to be done 30 minutes to 45 minutes every day, 5 times in a week, 8 to 10 repetitions. You will prove to give a good result. I've noted down the asanas. Let's begin with Surya Namaskar, Sun Salutation. Second comes Paschimottanasana. It decreases your tightness. Third comes Baddha Konasana, that is a butterfly pose, which is very important to decrease adductor tightness, especially if you're planning for pregnancy. Next is Bhujangasana, which is also known as Cobra pose. Then is Dhanurasana, which is a bow pose. Also Shavasana. Important here is to inculcate breathing very properly with the asanas. Do not overpush yourself. Slowly and steadily you will get the range. I hope this was useful. In my next video, I will come with a few important tips from the physiotherapy point of view. Till then, take care.